Haemorrhage. Objectives: to distinguish between the different types of bleeding, to be able to control bleeding, to minimize shock and infection. Few facts. Bleeding, technically known as hemorrhaging, is the loss of blood escaping from the circulatory system. Bleeding can occur internally, where blood leaks from blood vessels inside the body, or externally, either through a natural opening such as mouth, nose, ear, urethra, vagina, or anus, or through a break in the skin. Classification of bleeding: capillary bleeding, venous bleeding, arterial bleeding. Capillary bleeding. Capillaries are the smallest blood vessels in our body. They are about as thin as the hair on your head. When a minor scrap or cut opens some capillaries, the bleeding is almost always very slow and small in quantity. Body's natural clotting mechanism is able to stop most cases of capillary bleeding within seconds to minutes. Blood oozes from the wound. Venous bleeding. Deep cuts have the potential to cut open veins. A cut vein typically results in a steady but relatively slow flow of dark red blood. The best way to stop most cases of venous bleeding is to put direct pressure on the wound. Arterial bleeding. This is the least common and most dangerous type of bleeding. It involves bright red blood that comes out in large volume and in spurts that correspond with each beat of the heart. In most cases of arterial bleeding, direct and extremely firm pressure on the wound is best way of stopping it. If direct pressure is not applied, a severe arterial wound can cause to bleed to death within a few minutes. Comparison: arteries, spurting blood, pulsating flow, bright red color. Veins, steady, slow flow, dark red color. Capillaries, slow and even flow. Types of bleeding and their characteristics. Arterial bleeding. Color of blood is bright red. Flow in spurts in time with heartbeat. Severed main artery may jet blood several feet high. Rapidly reduce the volume of circulatory blood. Venous bleeding. Dark red in color. Blood gushes out profusely. Capillary bleeding. Blood oozes out at site of wound. Blood loss is usually slight. Control of bleeding. Apply direct pressure with gloved hand or sterile dressing. Bleeding stopped. No. Elevate extremity above client's heart. Continue direct pressure. Bleeding stopped. No. Locate pressure point. Apply pressure. Maintain direct pressure over wound. Bleeding stopped. No. Bleeding from extremity. Apply tourniquet. Use it as last resort. Transport to medical facility. In case bleeding stops, care for wound and seek definitive care. Elevate wound site. If possible, raise wound site above the level of victim's heart. Pressure points. A place where a pulse can be found, such as in the femoral artery. There are significant risks involved in performing pressure point constrictions, including necrosis of the area below the constriction. Maximum time for constriction is around 10 minutes. There is particularly high danger if constricting the carotid artery in the neck, as the brain is sensitive to hypoxia. Brain damage can result within minutes of application of pressure. Find proximal pressure point and press on it. Radial, ulnar, brachial, axillary, femoral arteries, not the carotid artery. Apply direct pressure to the site. Tourniquet. Apply band above injury site, tighten to stop bleeding. Use it as last resort, as it is risky. Note time of application. Reassess the part frequently. General management. Minor extent of external bleeding. Apply direct pressure with sterile dressing. Clean the wound by rinsing lightly under running water or using an antiseptic wipe. Elevate above heart level. Apply small adhesive, sterile dressing. Seek medical aid if bleeding does not stop or if there is risk of infection. Severe extent of external bleeding. Dial for ambulance. Expose the wound. Apply direct pressure over the wound with a sterile dressing. Elevate and support the wound above heart level. Lay the casualty down. Apply sterile dressing and secure it firmly in place with a bandage. If bleeding seeps through, apply another layer of bandage on the top. Treat for shock. Types of wound. Incised wound, abrasions, punctured wound, lacerated wound, contused wound or internal bleeding, gunshot wound, impalement, amputation, crush injuries, abdominal wound, chest wounds, incised wound, abrasion, punctured wound, incised wound, abrasion, punctured wound. Sign and symptoms. An open wound, rapid weak pulse, swelling, pain. Treatment. Apply direct pressure using a sterile dressing. Elevate the wound above heart level. Apply a sterile dressing over the wound and bandage firmly to secure it in place. If bleeding seeps through the bandage, apply another layer of bandage over the previous layer. Apply cold compress to the swell. Check and treat for the shock. Limitations. Moving the fractured, dislocated limbs may aggravate the condition. For casualties suffering from lower body fractures, dislocations, it may not be possible to treat for the shock. Warning. Do not bandage too tightly. Constantly check for circulatory refill. Do not remove the previous layer of bandage. Do not apply cold compress for more than 10 minutes as it may result in frostbite. Lacerated wound. Signs and symptoms. Large area of raw flesh, bleeding, rapid weak pulse, pain. Treatment. Apply direct pressure with a sterile dressing. Elevate above heart level. Apply sterile dressing and secure with micropore. If bleeding seeps through, apply another layer of dressing over the previous layer. Check and treat for the shock. Limitations. May not be applicable for casualties who are also suffering from fracture or dislocation on the limbs. If casualty is suffering from lower body fracture or dislocation, it may not be possible to treat for shock. Warning. Ensure that the sterile dressing is larger than area of wound. Do not remove the previous layer of dressing. Do not apply cold compress for more than 10 minutes. Contused wound. Internal bleeding. Sign and symptoms. Blue-black discoloration, swelling. Treatment. Apply cold compress to the area of injury. If blue-black coloration persistently remains, consult a qualified medical worker. Dial for ambulance if it is the case of internal bleeding. Warning. Do not apply cold compress for more than 10 minutes as it may result in frostbite. Gunshot wound. Sign and symptoms. Open wound, entry and exit with shaft of a bullet tip. Rapid weak pulse, swelling, pain. Treatment. Douse entry and exit wounds with water for 10 minutes. Apply direct pressure using a sterile dressing. Elevate the wound above heart level. Apply a sterile dressing over the wound and bandage firmly to secure it in place. If bleeding seeps through, apply another layer of bandage over the previous layer. Apply cold compress to the swelling. Check and treat for the shock. Limitations. This may not be applicable for casualties who are also suffering from the fractures or dislocations on the limbs. If casualty is suffering from lower body fractures, dislocations, it may not be possible to treat for the shock. Warning: do not bandage too tightly such that circulation is impeded. Do not remove the previous layer of bandage. Do not apply cold compress for more than 10 minutes. Impalement. Sign and symptoms. An object embedded onto the skin of casualty. Bleeding. Rapid weak pulse. Swell. Pain. Treatment. Using sterile dressings, build up padding on the both sides of the object until the object is stabilized. Secure the padding with bandages. If bleeding seeps through, apply another layer of bandage over the previous layer. Apply cold compress to reduce swelling. Check and treat for the shock. Limitations. If casualty is suffering from lower body fracture dislocation, it may not be possible to treat for shock. Warning: do not bandage too tightly such as circulation is impeded. Do not remove the previous layer of bandage. Do not apply cold compression for more than 10 minutes. Amputation. Sign and symptoms. A stud on the casualty. Amputated body part nearby. Rapid weak pulse. Pallor. Treatment of the wound. Apply direct pressure with a sterile dressing. Elevate the wound above the heart level. If bleeding seeps through, apply another layer of bandage over the previous layer. Check and treat for the shock. Amputated part. Collect the amputated part and wrap it in gauze, after which wrap it in a plastic bag and place it in another plastic bag of crushed ice. Send the amputated part to the hospital together with the casualty. Limitations. It may not be applicable for casualties who are also suffering from the fractures or dislocations on the limbs. If casualty is suffering from lower body fracture dislocation, it may not be possible to treat for shock. Warning: do not remove the previous layer of bandage. Make sure the plastic bag is not damp. Crush injuries. Sign and symptoms: a fallen object crushing onto the casualty, pain, treatment. If casualty is crushed for less than 15 minutes, release him or her as soon as possible. Treat any possible wound, fracture found on casualty. Check and treat for shock. Dial for ambulance. If casualty is crushed for more than 15 minutes, do not release the casualty. Instead, call for ambulance and reassure casualty. Abdominal wound. Sign and symptoms: an open wound, rapid weak pulse, pallor, possible protruding intestine. Treatment: if intestine is protruding, cover with large moist sterile dressing, then cover with a plastic sheet and secure it tightly. If there is no protruding intestine, check if wound is horizontal or vertical. For vertical wounds, do not raise legs. Instead, just apply pressure at the site of wound to control bleeding. Check and treat for shock. If wound is horizontal, keep legs propped up or raised and cover wound with sterile dressing. Check and treat for shock. Warning: do not raise leg if wound is vertical. Chest wound. Sign and symptoms: an open wound, rapid weak pulse, possible foreign object still embedded at wound, pallor, sucking wound if lung is punctured, wheezing sound if lung is punctured. Treatment: cover the wound and apply pressure with a sterile dressing. Cover with a plastic sheet and tape 3 sides of the plastic, leaving the bottom side open. Apply a chest bandage. Check and treat for shock. For casualties with punctured lung, tilt him or her to injured side. Regulate casualties' breathing.